Hi, I'm Dr. Qadri. I'm a neurologist and co-founder of QWorld.Ai. Let's dive into one of our questions. All right, let's do a step 2 question this time. We already had one generated, so let's go ahead and do this. All right, so we have a 32-year-old lady, gravida 2 para 1, who's presenting with a complaint of blurred vision in her right eye for the past week. Okay, she's 28 weeks pregnant, no past medical history, and she has a relative afferent pupillary defect in the right eye. Okay, oftentimes when you hear that word, RAPD, that's typically a sign of optic neuritis. Okay, fundoscopy reveals a swollen optic disc. So there you go, swollen optic disc, RAPD, blurry vision, young woman. That's probably what it is. However, it's going to be important to think about other things such as, I don't know, some kind of a tumor or a mass in that area of obstructing the CSF flow. But let's look at the answers. Diabetic retinopathy, she's not diabetic. Retinal detachment, that's not going to look like swollen discs. Preeclampsia related retinopathy. I don't know enough about that. Maybe it's bilateral. Optic neuritis, sounds like it. The only thing that doesn't fit this is that typically patients will report pain on eye movements, so not exactly seeing that. But so far, that sounds like it. Central retinal vein occlusion. Important, however, you might see some kind of hemorrhages, these blots on the retina. So I don't know if this is CRVO, but let's try optic neuritis. All right, so let's share some AI insights. So unilateral vision loss, relative afferent pupillary defect. Sounds like it. Okay. Preeclampsia-related retinopathy would typically present with hypertension and proteinuria, which are not reported in this patient. Okay, that's helpful. Let's look at the AI insights. All right. So key presentations: unilateral vision loss, RAPD, optic disc swelling. Diagnostic workup includes MRI, lumbar punctures, may show oligoclonal bands, of course, because it could often be a sign of MS. Treatment with steroids, so IV methylprednisolone is the way to go. You can do oral steroids too. And complications, well, a lot of them will just get better, never have them again, but a good amount of them can have long-term vision loss. It can also just be their first symptom of MS or other autoimmune neurological disorders. The mnemonic doesn't sound like it's the most helpful right now, but sometimes it can be pretty good. So we have some images here of optic neuritis. So this is edematous right eye, normal optic disc. Okay, so that's probably what it looked like when it was swollen. Close-up view of a swollen optic disc. Similar images. You have some more detailed image fundoscopy for a optic neuritis. All right, sounds good. Let's see if we can try out the AI chat feature. This is a new one we have. Okay, let's see. Don't we also get pain on eye movements with optic neuritis? Let's see what it thinks. Okay. All right. Let's give it a second as it processes that. Yeah, pain on eye movement is a common symptom. You can often feel like a dull ache behind the eye. You have some references here as well. So let's click on one of these, see what we get. Okay, good. Just pulling from the American Academy of Ophthalmology, where you can look at this and get some more information. Pretty cool. All right. Well, if you like this, please follow us, like and subscribe for more content on the USMLE. Thank you.